Okay, so again, welcome back. We are presenting on Allen Women's Health today for the Newcomers Community Forum, and we have Shalise Williams with Allen Women's Health presenting. I think I already said that. Anyways, I'll just hand it over to you, Shalise, and we're gonna have a nice conversation. If you're willing to be on camera, that's awesome. It can be more like a conversation that way, but if not, totally understandable. I'll hand it over right now.
All right, are we ready? You want me to go? Okay, hey everybody, my name is Shalise Williams, and I am the health educator here at Allen's Women's Health. If you guys have questions, you can ask me at any time. I usually try to have to slow down a little bit because I talk pretty fast sometimes. So I will just do my little spiel, and then if you like, you can ask questions afterwards as well. So my job here at Allen's Women's Health is to go around our community and talk to people about our clinic and the services that we provide, as well as talk to people about STIs and birth control and long-acting birth control. If everyone does not know exactly where Allen's Women's Health is, I'm gonna mess that up quite a bit here after saying it so many times. We are not in the hospital. A lot of people think we're located in the hospital. We are right outside the hospital on the Donald side. We are right behind the fire station. Plus, we're right next door to the Allen's Nursing College. So it's pretty easy to find. Looks like a little cottage, kind of just in the spot, you know. And so that's where we are located. Also, we are a Title 10 clinic. I don't know if everybody knows what a Title 10 means for our clinic, so I just will explain a little bit of that for you. But it's Title 10's mission is to assist individuals and couples in planning and spacing births, contributing to positive birth outcomes and improving health of women and infants. So Title 10 is the only federally funded program that's dedicated to family planning and preventative health services. So the program is designed to provide reproductive health services and education with the priority given to low income families. So that's what Title 10 stands for. So your cost of being a patient is income based here. They charge on a sliding fee scale. The services are free though to anyone who's enrolled in Medicare or whose income is 100% below the federal poverty level. So that's what Title 10 stands for. That's what the clinic here, that's what we can do a lot of different things. Some clinics can't do because we are a Title 10 clinic. So the types of services that we provide here at the clinic, we do pregnancy tests. We do also do HPV vaccinations for people. We do Pap tests. We offer PrEP. We do birth control, like I said, in long-acting birth control, like IUDs. Some people might know that they don't want to have children for a while. There's some IUDs that can last you 10 to 20 years. And a lot of people don't know that as well. We give away free condoms. You don't have to, you can just come into our clinic. You can walk straight into the bathroom, grab you some condoms and walk out the door. You don't even have to speak to us if you don't want. Or you can just come to the front desk and say, hey, may I have some condoms? And we'll give you a bag of condoms. So we're trying to make sure that everybody stays safe. We also do emergency contraceptive, and we also do STD testing and treatment. Also in our clinic on Wednesdays and Thursdays, we have WIC in our offices too. So, because sometimes people can't make it to more than one appointment at a time, especially if you have a child on your hip and one walking around, it's not very convenient for you to have to go to different places. So we try to make this kind of a one-stop shop so that we can make sure that people get all their services. Also in our clinic, we have a maternal health side, which has 2 nurses on that side, as well as 2 social workers. So they can help our patients with resources if they need to find different resources to help them and their families. And on our other side of the clinic, we have a family planning side. So if you're pregnant, or if you want to get your testing done, if you want to come in for STD testing, or even if you just want to talk about different forms of birth control that might work for you. What I like about our clinic is that we are all women staff in here, and it's kind of a small place, you know, so everybody kind of know each other, and people who have been coming here a lot have been coming here for years. The next thing that I would say is that all our services are confidential. So you don't have to worry about us telling anything that you told us unless you give permission for us to tell who you want us to tell. And then you have to fill out a form for that. Also in our clinic, there is no certain age of person that can come in here. Like, for example, for young people, you do not have to have your parents' permission to come into our clinic to have STD testing or treatment or to get birth control. And that's under the Title 10 umbrella that they're able to do that. Because sometimes kids might want to get on birth control and their parents do not want them to get on birth control. And kids don't always want to get on birth control because they're ready to have sex. You know, you can use birth control for acne, to regulate your period, stuff like that. And sometimes parents don't quite understand that. So we do see patients in here. The youngest patient that we've seen over the years, not while I've been here, was 8. And so, but that's why we have our maternal health side, so those social workers can talk to whoever comes in our door first. They have to talk to our social workers and stuff to make sure, why is an 8-year-old coming in here to get birth control, right? And so there's different steps to go through the building. Also, let's see, what else? We encourage people to, like, when they come in or when you're thinking about STD testing, if you're not comfortable with your partner or you guys might not just be exclusive to one another, you can come in and get tested. Or if we always suggest that people, if they're switching partners, get tested in between so that you know that you're safe for your partner, your next partner coming up. And it's okay for you both to come in together and get tested. A lot of people do not know that just because we have women's in our name, we also see men as well. So men can come in and get STD testing and treatment. They can come in and get condoms. Or if families, we have family planning. So if families want to come in together and decide when they want to have the babies, you can plan babies. You just don't have to be pregnant, you know, you can plan for babies. So we can see men to come in and talk about family planning as well. Let's see, what else? Also, the one other thing that we're doing that I think is really great. So we have a Black doula support service that we just started. And so in the state of Iowa, we are partnering with the Iowa Department of Public Health to do this. And in the state of Iowa, we're talking about Iowa, but in Black families, the mortality rate for births is really higher than white patients. So we started a Black doula program to train doulas in the state, as well as so our clients can come in and they can have our services alone, or they can have the doula services alone, or we can put them together and you can have doula services and our services as well. So we're trying to get the mortality rate to go down. So that's what that's for. We got little flyers for those, so I can get those to you if you like. It's basically to help you with your birth plan and education. It gives you labor support, breastfeeding support, as well as navigating the healthcare system. So it is, it's called the Free Birth Doula Support Services, and it's for African-American women or anybody who identifies as Black. That's just something new that we started, just so we can try to get that mortality rate down, see if that helps out at all. So I think that's a great service for us to have and provide for our clients here. Let me think if there's anything else that I'm missing. So I can go around anywhere and talk about the services that we have. So anytime that you guys might have an event or that you'd like me to come talk to, I have no problem talking at all. I can sit outside of stores and talk. I've been to all the stores around Allen, giving the information out to everybody. I do support groups. I've been to House of Hope. I've been to Pillars. I've been to Four Oaks. I go all over the place. I go to the Waverly Shelter. Anywhere that I can talk, I'm going there. So that's kind of what I have today as far as all the things that I do and the services that we provide. So does anyone have a question for me? And I might think of something else along the way. I don't know. I hope that wasn't too fast, but you know.
That was great. Oh, we have a question. Adriana, go ahead.
Yay!
So for the emergency contraceptive,
Mm-hmm.
do they need to make an appointment if they want to get that, or can they just walk in the clinic?
Well, we can take walk-ins. It's good to call and make an appointment just so we know for sure that you can get in that day, but we do take walk-ins as well. But even if you call, we could most likely, sometimes we can get you in that day, but if not that day, for sure the next day. So yeah, but usually with emergency contraceptive, they try to get you in right away.
Right away. And how does that work? Like,
So it depends on what you're trying to get. Usually with emergency contraceptive, like say if you had a oops and your condom broke, like say for the Plan B pill, you want to take that between 3 and 5 days after having the oops, so that you can make sure that that pill works for you. And the Plan B pill is not, of course, an abortion pill because you're not pregnant yet. It's just to help the sperm cell from getting to the egg. And so there, it depends on what the person is wanting. The Plan B is something that's pretty, popular as far as emergency contraceptive. So, but even if they just want to call in and talk to a nurse, we do that as well. You just call our main number, and we have awesome receptionists, and they will hook you up with a nurse. And so you can figure out and make sure that you feel comfortable when you come in, or with your decision on what you want to do.
then do you guys still do the education, like the sex education for teenagers?
Sure do. That's my job.
Oh, okay.
Yes, that's what I do. So yeah,
Okay.
so we used to have in our building Together for Youth. Well, they're on their own now. Well, I don't want to say divorce, but when I started, Allen Hospital and Together for Youth kind of separated, and so a lot of Together for Youth have like Waterloo schools. I'm in a couple schools, and I also go outside of our county too to go to different schools. So I can travel and come talk to people as well. And that makes my day, go by pretty fast when I get to do that. So that makes me happy.
Thank you.
You're welcome. Thanks for asking.
Other questions?
Come on now. Come on. Somebody.
I have a question. I just want to comment on the Black Doula project. I think that's a wonderful concept and a wonderful idea. So I'm really excited to see how that goes over, and
us too.
Address some stuff. Yeah.
Us too. We really just started maybe a month and a half ago, but we do have people participating in it now, so that's great. And I had even thought about getting trained in it, because like you can even call us about how to get trained in it. They're training people here, and there's 2 more trainings coming up, and that could be a great job for people who wouldn't want to see life coming into the world. Well, some people might not want to see that, but I would like to be there to see life coming into the world. Yeah,
that'd be incredible for sure.
Interesting. Now I might close my eyes for some of it, but I would still like to be there.
Yeah, that's awesome.
It is. It really, really is a great program. So that they even thought about it, So
yeah. So that's based out of Allen Women's Health then?
Yep. So they come here, and then we resource them out, and then there's a business called the Black Doula Collective. So us and IDPH are all together doing this. So there's a couple different places. Right now, well, they might have trained some in Waterloo already, but right now a lot of the doulas are on the outside of the state. So, but you can still have Black doula support, not out of the state, but out of Waterloo. Black doula support, even if it's phone calls or Zoom or something like that as well. So yeah,
awesome.
It's a very good program. So I'm hoping that, because right now it's kind of a trial, but there's something that they're trying to plan to keep it going. So
yeah, awesome.
Yeah.
I know someone that's interested in the doula program, like doing it herself. So she just calls Allen Women's Health.
Yep, you can call here, and then we can tell you about
for a specific person, or just.
Well, you can ask for me. Well, let me see. I'll look it up, and I'll send information so that I'll give it to Tracy so that she can maybe send it out to everybody, and I can definitely get you that information who you contact.
Okay, thank you.
That'd be great. Welcome. Yeah.
Yep, I got it for you. I'll write it down so I don't forget it.
Okay. Other questions, comments, insights?
Anything.
Is it Ayuko? how do I say your name? I'm so sorry. You've been on here, so and you're going to present pretty soon, so I need to know this.
I want to know too.
So it's Ayuko.
Ayuko. Got it.
Love
Ayuko. What do you have any questions for Shalise right now?
No, nothing right now, but thank you.
Awesome.
Oh, fine. Yes.
Thanks for popping on. Yeah, Monsoon's based out of Iowa City, if I understand correctly, but they serve people up in the Waterloo areas. Actually, I think throughout the whole state even.
Yeah.
Well, you know, I do. Oh, I'm sorry. You go ahead and speak.
Oh, sorry. So yeah, we have 3 offices. So our main office is in Des Moines, and then also one in Iowa City, and then in Dubuque, where I'm at.
Okay. Well, there we go.
So my past job, I worked at Amani Community Services as a sexual assault and domestic violence advocate. So I do know about, especially the culturally specific agencies, but I do know all about all the agencies in the state because of that
awesome.
job. I worked there for over 5 years. So yeah.
Wow.
So I do that as well.
Very
Right now I'm volunteering with Riverview Center. So I try
Okay.
to spread myself thin, you know.
Yeah.
Oh, that's where I'm sharing my space at, with the Riverview Center here.
Yeah.
Oh,
yeah.
cool. Everyone's
Yeah.
connected, man. That's great. And that's
Right.
important, you know, like being community partners. So
It is very important. And advocacy is very important for women who deal with that stuff. I am all in for that. So
yes, for sure.
Mhm.
All right, cool. Carol, do you have any questions for Shalise right now? Or
No, I don't. Thank
Okay.
you.
Hi, Carol.
I was happy that some of the things that you use are also to prevent the sperm and egg from uniting. Because
Right.
that would help people that don't believe in abortion, later on. So
Right. And here of course, we don't do abortions here at our clinic. It's just something that we can tell people that's kind of a choice if they want to make it. It's an option out there, but we don't, tell people that's what they should do or not do, or we don't do it here at the clinic ourselves. But I think, with all this stuff, it's a woman's choice, a woman's body. Let us individually pick what we want for ourselves. That's important for me. That's going to be my next mission. I don't think men should be telling us what we need to be doing with our bodies. Now, if we start talking about men and what they need to do with their bodies, I think they'll be quiet.
Can you talk to my mom about me not having another kid? Because she's on me right now about that. I'm like, I don't want another kid. I'm good.
Right.
Like,
and you do not have to have one.
That's what I'm saying. But she's like, but you do. And I'm like, but I don't. I don't do
Right.
anything. So it's fine.
But no, I'm
Yeah.
pretty sure I don't want a kid.
Right. See, I'm good. I'm good.
Yep. Right.
Let's see. Vanessa, I don't know. Have you been on this before, Vanessa? Or do you have any questions or comments? And Sarah's back. Hi, Sarah. You kind of missed the first little tidbit that was about the services in general, but we do have Shalise here if you have any questions pertaining to women's health and men's health too.
Or I can tell you about the services.
I mean, I don't want you to repeat anything, but I can definitely watch the recording for.
Okay.
Yeah, for sure. I forget
Thank
that we're
you.
recording sometimes and I just start talking, so.
Right. Yeah, I totally forgot already. Well, it's not super bad or too much, but we just do things like pregnancy tests, yearly exams, HPV vaccines. We offer PrEP. We do Pap tests, birth control. We give away free condoms, emergency contraceptive, STD testing, and treatment. That's a lot of the stuff we do. And we have other services, but that's our main stuff we deal with.
That's great. What about you, Barb? Do you have some additional insight to provide?
Oh, no, I was going to ask Shalise, how many presentations are you out in the community doing?
You're going in and out a little bit. I can't hear you.
I've got wheels on my chair and I tend
Okay.
to back away from the screen. About how many presentations are you doing, presenting different groups out in the community?
Well, this year, at the beginning of the year, it was a little slow because COVID was getting back up, up and around. But I do quite a few in a month. I will have to look at my charts and see, but I can do in between 10 and 5 in a month. It depends on how many people's calling and asking me to.
Well, you can
So.
still do Zoom presentations too. I mean,
For sure. And I did do that, but now I'm able to go out and about. So I like to get out the office instead of sitting in here on my computer. So anything that's in person, I am there. Yeah. So, but I do quite a few. Yes, I do a lot, Barb.
I actually had a question for Julie. Julie, so within the Congolese population, how do you feel women's health is being perceived in the Congolese population?
I didn't get your question, Tracy. Do you wanna say that again?
Yeah, so like in regards to women's health within within your community, do you think women's health is it valued within the community? Is it confusing for women in the community to understand like the different options that are available for them?
Yeah, I think it's confusing. Lack of information. Like the information about the birth control, those are like great information, but I don't know how the appointment go with the wise woman or the doctor, but usually they come up with no plan, like they don't know what they will do next, like for how they will space like the how can I say it? Like how they can avoid to get pregnant. I know one lady who had 2 children the same year. One was born in January and the other one in November. So those are kind of information that I was looking for so long, like how to direct them. They come to me, but I don't have a lot of information like about birth control. Also they ask me like, which one is the best? So I can't tell because I don't know, like, and that's great to know that you guys are offering it. So I know now where I can send them, I can take them myself, or maybe I can invite you one day. We have a church too. And
yes, please, I will definitely come to the church.
I gather with a lot of women like every Tuesday. So I'll see how we can do that. So you can maybe come, since you say you like to be in person.
Oh, yes, yes, I will come in person. Yes, yes.
So we can
I think it's easier to tell somebody when they can see you, you know.
I understand that I like in person too, but with COVID, it was a little bit hard. So yes, I think we can work on it to see how you can come like to us. I can invite them, usually the young women. So talk about if they have questions so you can help them a little bit better.
Right. And so if we get it all together that I can come talk to them, you can ask them what questions they would like to ask ahead of time. Then that way I can just come in and, you know, like read their questions and answer them for them. I would be happy to do that. Are you in Waterloo or?
Yes, I am.
Okay. Okay. Cool. Where's your church at?
It's at the downtown. So we're renting a suite there. Like I can send you my information after this. I can have you, I can send you my email and everything so we can stay in touch.
Yes, that'll be great. Yes. Yes, I can put my email right in the chat there so that
sounds
everybody
great.
will have it.
Yeah.
Awesome. Thank you, Julie.
Thank you so much. But yes, it's hard for some people who aren't who have like language barriers to be able to get the information they want. Because but also here in our clinic we have the language line, and so we call interpreters so they can talk for us, and so we can get the best outcome for the patient that comes in. So I wouldn't want, you know, someone coming in and not getting a plan or not getting the information. I think that's very, very important. And most likely you're not going to come back if you're not getting anything, you know, from this, you know, what you're trying to get any information of what you're trying to find out. So I think we can help out with that.
Also, I have a question, like how people come to you. So I'm talking about pregnant women, how they come to you. Do they have to have a doctor at Allen Hospital or
they do
from
not.
any? Oh, okay.
They do not. They do. You can just they can call our number, and I'll put that down too. They can call our number and make an appointment, and then after they make the appointment, usually your first initial appointment, you will have to kind of see everybody just to make sure we find out what best works for you. And so that appointment might take hour and a half to 2 hours.
Mhm.
The first initial appointment, but after that, especially if you're pregnant, we can definitely help you. Or if you're trying to, prevent pregnancy, we can help for sure, for
Okay.
sure.
Yeah.
But yeah, that's it. They can definitely come to us and we'll take care of them.
Okay. Sounds good. Thank you.
And everyone here is kind and nice and make sure that everything will be taken care of. So
Okay.
there's not a mean person in this building. Well, I haven't met them yet.
That's good to hear.
Yes.
Yes. No, I wouldn't. I would come to this place if, I had to. I would come here. So I
Yeah.
think it's a great place. It's a great place for me to work, at least.
Mhm.
I trust you.
Thank you.
Yes.
Yes, I try to reach out to all kinds of different communities just to, come and give them the information, because a lot of people don't know if you're not
That's
from
a
here.
problem. Yeah.
Yeah,
That's good.
good.
Awesome.
I-
Adriana, oh, I'm sorry, go ahead, Sarah. What are you saying?
I just have a question. Are there some services that are free and open to people without insurance? And are there some services that are available? And I apologize if I missed this in the first 20 minutes, that are available on a sliding fee scale if they do not have.
Yes. So yes, all of our services. So the cost to the patient is based on their income, and then so they're charged on a sliding fee scale for sure. The services are free for people who have enrolled in Medicaid, or if their income is 100% below the poverty level. So when they come in, we do have a financial person that sees what works best for them, and we can also sign them up for Medicare here too. Our social workers will help them do that in their office. So, or we'll help them find something that best works for them. They can come in, they can just pay cash. Usually they figure it out. Like, you don't usually have to pay anything when you first come in anyway. They'll figure it out for you. So Penny's really good at that.
Awesome. Thank you.
You are
Is-
welcome.
Is the STI testing also on that sliding fee scale and same? Okay, perfect.
Yes, ma'am. It sure is. Yep. But you can get the testing done here and get treatment as well.
So many services, man. That's awesome.
Right.
Love it.
Right.
I was going to ask Adriana, so for within your community, in the Hispanic pop, how do you think like women's health is like perceived? Is it is it confusing at times? Is it do people value birth control? Like, is it a hot topic? It's like, what do you think?
All of those.
All of them.
Yes.
Yes.
We're so diverse. There's a lot of people that come from different countries and speak Spanish. So they
Right.
have different, beliefs and upbringings. So it can vary from person to person. Yeah.
Right. Yeah.
And
Some
sometimes it's,
some cultures don't believe in it or don't believe in talking about those things.
yes.
And as a woman, it's very important to talk about your health and your sexual health. I think it's very important. And so if we can kind of get that stigma out the way, and it's about us being healthy as women, I think that people may understand that a little bit better. So that's why I do like to come to things like this, to be able to give proper information to people. So if you ever need me too, you let me know.
Yes,
And we can talk to people as well about the clinic and being healthy. So yeah.
Yeah, like I never had any talks about anything
Okay.
growing up.
Okay.
So
Yeah.
finding out on my own, and that's hard.
Right. And as so did I as well. Found a lot of things out on my own. My mom was a young parent. And so, if she didn't know certain things, how are you going to, teach your kid that besides, experience? So we didn't talk about those things when I was younger, neither. I was a teen mom. So that's why I think I'm so passionate about it now. My daughter that I had as a teen, I'm like, I don't care if you get pregnant the day after high school, just don't get pregnant in high school. And she didn't have a child till she was like 25. So I'm okay with it.
There was a different person before. She used to do the youth talks. That's why I had asked. But at that time, my daughter was 3, 4, now she's 15.
Oh,
And she
yeah.
used to ask me like these really hard questions. And I never knew what to say to her. I always
Right,
like
right.
avoided them. Like, don't ask me
Right.
that. I don't know the answer.
Well,
But she helped me like answer her. Like, and
yes.
then she gave me a book. Oh, that was so helpful.
Oh, good,
Yes,
good. She
yes.
sounds like an awesome daughter then.
Yes, that
Because she
helped me
wants to
too.
know herself, you know, and
Yeah,
she's helping you
yeah,
out. So,
yeah. And since
yeah,
I didn't know how to answer her, nobody ever talked to me about it.
right,
Like
right.
talking to her with the truth was all I had to do at her level.
Yes, right. Very important. Also, you know, people can call here and ask questions and ask the nurse, you know, how could I best address my child this way? Or come in and talk to one of the nurses. They can give you advice as well. Or, you know, with the internet readily available for everything, you can find anything nowadays. So
I think that's huge,
job.
right? Like having you as a resource, like a local resource for families to either call in or stop by, because yeah, like Adriana was saying, those conversations are really hard.
Right.
Like, and you just don't know how to address them half the time. And
Mhm.
especially if it's like, maybe it's like a single dad and they're like, and with like a daughter, it's like, what do I do? Or
Right.
a single mom with a teen. It's just like, how do I address this? Because it's like a little weird, you know? And
It is. It's really
so-
weird. Yeah, yeah. Even with me with my own kids, I was like, okay, I gotta talk about this stuff. But you know, you just gotta push through and do it. It's best for them to be informed than not to be informed.
yes.
Just so they know how to respond when it happens to them, you know.
Mhm. Yes.
And
Yeah.
you know, I also I go to Four Oaks and that's all guys there. You know, I even teach the guys about how to respect themselves and
Mhm.
respect the people they're talking to, you know.
Mhm.
And then you give the example, well, what if it was your sister or your mom, you know?
Mhm.
And then they're like, well, I would do this or I would do that. I'm like, no, let's figure it out this way. So
Right.
you know, so men need it as well, you know. If and guys more get a pat on the back if they're doing something at a younger age. Girls get a label.
Mhm. Yep.
So,
Isn't that something? Now that's gonna
mhm.
put me on a soapbox. I can't. I'm trying to be chill. I get on soapboxes when I get heated.
Right.
I just want to point out in the chat here, we have, as a Pacific Islander, Shalise, to be specific, I could totally relate to that. So now as an advocate, I do a lot of outreach to help me navigate myself through the barriers and to overcome it within my community. And I feel like that's very true for like, I feel like there's a reason why people get into this line of work as far as like this, kind of like a social work vibe where it's like you're helping out your community, and
Yes.
it's typically like some type of a catalyst event of sorts that like draws you to this field to help out others, because we all care so much. We're all trying to better the areas that we live in, you know. So
Right.
that's awesome.
That is very awesome. I love that.
Awesome. Cool. Well, are there other questions or other thoughts? Okay, I'm going to stop recording now.